The National Council of Provinces' approval of the National Health Insurance Bill on Thursday has not stopped receiving criticism. The bill now sits before President Cyril Ramaphosa to be signed into law. The legislation establishes legal framework for the government's universal health coverage policy, which intends to do away with South Africa's two-tier healthcare system and guarantee that all patients receive free services at the point of delivery. Joining me to discuss this development is the former president of the Health Professionals Council of South Africa, Dr. Kgosi Letlape. Dr. Letlape, appreciate your time. Thanks so much for speaking to us. Your reaction to the rubber stamping of this NHI bill?
Well, exactly as you say, it's rubber stamping. It's a political policy, and what you use is the numbers in Parliament for a party policy to come through. It's not about giving serious thought to what is being proposed and applying your mind. That is not what happens at that level. So you just rubber stamp.
It's quite an assertion that you talk about not giving serious thought to this process. Why would you make that statement?
You know, there are things that just don't make sense. In your intro, you talk about pursuit for universal health coverage. The pursuit for universal health coverage can't be achieved by creating a third fund. You can't talk about two systems and you are introducing the third system. What you should be doing is to seriously repealing what exists and replacing it with new legislation. So what you're going to end up with, you're going to end up with NHI Bill, Medical Schemes Act, and the current way of funding public healthcare system. And all three will exist in law. What should have been done was to create a framework where you are either amending the Medical Schemes Act so that it represents a path to universal health coverage. How do you get universal health coverage? It's about your healthcare benefits. That's what health coverage is about. It's about healthcare benefits. There's nothing in this bill that speaks to those issues. Our problem is not money. Our problem is separateness. Our problem is wastefulness. And there's nothing in that bill that begins to address those issues. So you're creating a fund. It's not going to sort the problems that we have of separateness. You are creating a third part. So we'll have a three-tier system. You're going to have medical schemes, you have public health, and you're now having what I would term a low-cost medical scheme. And all of them will be in law. The Medical Schemes Act has not been repealed. The current way of funding provincial and public health care has not been reformed.
But is it necessary to repeal the medical aid bill, if that's what you call it, as you've suggested, if obviously what the NHI bill seeks to do is offer choice? Because if I can go into a facility and get treated without having to pay, then I don't have to worry about my medical aid.
But what choice are you offering? That was the promise of medical aid. But all of us on medical aid, when you go into hospital, you're worried about what your co-payment is going to be. When you have to go and see a doctor, it's about what is the shortfall. When you go to the pharmacy, they're asking you for a levy, or they're telling you what drugs
doesn't the
are
NHI
not
bill
covered.
then take care of that?
It doesn't. It's just creating a new fund. That's all it does.
So
where in the bill are those issues addressed? You see, what should have been done is to ensure that if you want to have proper reforms, we know the challenges in the Medical Schemes Act. We've had a health market inquiry. Implement those recommendations where you stop having too many packages. You start having universal health coverage. You outlaw out-of-pocket payments, shortfalls, people running out of medicines before the end of the year, and levies. That's how you create universal health coverage. So you don't just come up with flowery language when you have existing problems that you are not addressing. I mean, when you have a Medical Schemes Act that remains, how are they going to move me from my medical scheme, or how are they going to move themselves from PARMED to NHI when the Medical Schemes Act remains?
So are you saying that it then becomes compulsory for everybody to be on the NHI?
It can't be compulsory. You're just adding a third component. Because whilst they still have a Medical Schemes Act that empowers them to be on PARMED, that is the law. Until that is repealed, you can't force those people into NHI. You know, this thing of people thinking that magically, once you create NHI, everything is going to match, it's not going to happen. What's going to happen? You're just creating a lawyer's paradise. You know, when we've had things around land, when certain land acts have not been repealed, that you could not implement the new laws because you now had coexisting laws. You are creating confusion. It's lack of courage. What they should have done was to amend the medical schemes, reform it, so that it begins to address the issues that they purport to want to address of universal health coverage, cross-subsidization, reduced admin fees, and reform the public healthcare system instead of decreasing corruption, making sure that procurement is streamlined, the facilities are upgraded, and we don't lose money to tendering for cadres that don't have capabilities to deliver on the promise. Well, look at what happened with COVID.
Dr. Letlape, let's look at it this way, right? There are multiple ways of skinning this cat. One, obviously, is create the bill, for argument's sake, right? Have it fully functional before you start repealing any laws, because there's structures that have to be put in.
That's a fool's paradise.
You think?
That is a fool's paradise.
Why?
Because they are on medical aid. If anybody thinks parliamentarians are going to scrap their medical aid and be the first ones in NHI, why is not that in the framework? Why are they not starting with themselves that we believe in this thing so much that when the president
they're a minority. They're a minority. Surely this bill is for the masses.
They are not a minority. It's their act. It's their act. The Medical Schemes Act is
for the people.
It's not for the people. The Medical Schemes Act is an act of parliament. You can't have a parliament that now wants to introduce a third way of funding and think we idiots to believe they are creating a unitary health system. No, they are creating a third level. Let me tell you what's going to happen. They're going to continue on their medical aids. They're going to have a health fund that they're going to raid. There's going to be cronyism. There's going to be tenders for IT application. There's going to be wasteful expenditure. And they'll still be keeping their own medical aids that are administered by the current administrators. Ask yourself a question. We have a Council for Medical Schemes. In this bill, there's an intention to create a department inside the Ministry of Health where they started employing to manage this fund. Council for Medical Schemes is the statutory body. It's been doing this work for donkey years. What are you going to do with it? Why are you not reforming what the Council for Medical Schemes is going to do and using that infrastructure that already exists? Well, when you start a department inside the ministry, where do you think the money is going to come from? 10% of the NHI will be to sort those issues out. You'll have people that are employed inside that don't know what they're doing, and then you outsource a contract to cronies to give you the IT platform, to give you the benefit packages, etc., etc.
Well, Dr. Letlape,
it's about time.
You're a doctor, right? And obviously represent the interests of many doctors. Now, when you go into a hospital and you spend a night in hospital, you charge something in the region of 10,000 rand. It could be 10,000 rand a night. It could be multiple thousands, which really aren't justifiable. Now, what we understand and what the backers of the bill are suggesting is that health cannot be a luxury, right? And right now, you go into a private facility, you're paying astronomical fees which aren't actually justifiable. So this offers an opportunity to the average individual who cannot afford to pay 10,000 rand to be in hospital, but still wants treatment. Because what the government purports to do is that they will create a fund that will pay service providers and mitigate those challenges.
The government has created a fund called the Medical Schemes. Why are they not fixing those problems inside that fund? What makes you think when you have created a fund that you now cannot manage properly? You think the solution is create another fund that you hope you're going to manage properly. When you have the Medical Schemes Act is an act of parliament. Why are they not fixing all those things that you're talking about inside the Medical Schemes Act? There was a health market inquiry to fix those issues. What makes you think
what are those issues that need to be fixed?
Oh, those issues are issues of coverage. No universal coverage. You go into that medical aid, you are seen as an individual. There's no cross-subsidization. You have your package. Your package gets exhausted. We give you a savings account so that you manage your own healthcare. You are treated as an individual. There's no cross-subsidization. There's no universal package for people on members. All the things that they are promising for the NHI. The medical schemes is an act of parliament. Just explain to me, how do you think creating a new funding act is the way you're going to sort out the problems under the current act that is under your jurisdiction? What you do is all those things that you're proposing in NHI are reforms that you should be doing inside the Medical Schemes Act. Now, you say, I'm a doctor representing doctors. No, I'm a doctor, and I have an ethical obligation to put my patients first. We do not put ourselves first. All those issues that have been created, an unfavorable working environment where it's all about corporates and not about patients or providers, are things that have been created under the act of this parliament. A new act is cowardice. It's a way you're creating a new feeding trough. That's all you're doing. So you don't have the courage to do the work that needs to be done to fix healthcare, to fix the separateness, and to create something that is for all of us.
So this is you airing your voice and the voice of many who think like you. Has there been a consultative process?
It should not even be my voice. You know, I was reading through something that was posted in a group that I was in, and they say deodorant. Common sense is like deodorant. It's those that need it that don't apply it. And that applies to all of us as South Africans. Are we that stupid to think that a parliament that has an act that finances healthcare for people that are employed, that are privileged, can sort out those problems by creating another fund? It doesn't make sense.
So let me ask you that.
Let's just stick to common sense. It doesn't make sense. We know that there are challenges in the Medical Schemes Act. There's a health market inquiry, and they are not implementing the recommendations of the health market inquiry. When you go into things like SED, political interference. Now, you are creating an NHI fund that will be under political control. That's all that you're creating. You're giving powers to a minister who's going to appoint the people that are going to sit there. You are rearranging the chairs on the Titanic. You are not sorting out the health problems that need to be sorted out. You don't have the courage to do what is done. You are giving national health a bad name. Because what is national? Ab initio, from what it suggests, should be this is where all of us will be. Where will be the parliamentarians? Where will the president be in terms of his own health care? Who will be funding it? It will still be funded by parliament, but in a separate thing. Administration, wastefulness, political interference, cronism, tender system. Those are the ills that we need to get rid of. Do you know that currently we have young doctors that cannot get community service? When people finish, nurses, they can't be employed. The monies are going to things they should not be going to. When you want universal health coverage, you don't need complicated systems. Because everybody, when you go to the public sector, nobody comes up with a benefit structure that classifies you on how poor you are and what you are entitled to. They just examine you, give you the care that you need. That's all that is needed. And you need a system that collects the information so that you can plan better. That's what they should fix.
So Dr. Letlape, allow me to ask you this, and that's so the National Council of Provinces has rubber stamps, as we've agreed. But let's talk about the consultative process that took place or didn't take place. Was it consultation with individuals such as yourselves to understand the implications of the NHI, or certainly its future shortcomings, or what should have been fixed without having to go to an NHI?
You know, a lot of us have said it, that you need to replace the Medical Schemes Act with a financing act that covers all of us. But you also need to commit that all those that are employed will belong to this common funding arrangement. and all those that are not employed, the government will put money on their behalf into that fund. That fund will be an independent fund, run properly, utilizing the expertise that we've accumulated over the last 40 years of apartheid health. If you look at government, it's got government employees. It's got an administrator called GEMS. If you look outside, there are independent administrators like Metropolitan, like Discovery. There's capability to manage these things. There's a council for medical schemes. Why does it not feature in this reform that we have? You are now creating a new bureaucracy that's going to sit inside the Ministry of Health. Does that make sense to you? What are you going to do with the Council for Medical Schemes? It's a statutory body. The minister appoints those people. What are they going to do? Why are we not reforming and using the resources that we have? It's time for South Africans to wake up to what is happening. We have to stop being gullible. You know, this issue of we've consulted. People can come and they give you a hearing, but they have their own plan and they're not going to listen to what you say. Is that consultation? I mean, this is ridiculous. I have been a proponent of national health. This is not it. And this will give a bad name to an opportunity to unite South Africans. But it has to be done properly. And I hope if the president of this country has any humanity in him, he will not sign anything that doesn't cover all of us, that doesn't unite us, that doesn't bring us together. Just like the Springboks one, we didn't have low-cost Springboks, high-cost Springboks. We had one team that all of us supported. We need a reform that brings us all together. Not one that says, oh, what is not covered by us will be covered by medical aid. You are now setting up a system that's bound to fail. Anybody that has the courage to deliver what is promised of you best quality health care for all can talk about what is going to be included. It's going to say, we're going to give you all that you need. And issues of who gets what will be left to the professionals that are well-trained, that know what to do. You know, currently, not everybody that needs a renal transplant gets a renal transplant. It's left as a clinical decision based on the resources that we have. So all this notion of, oh, if you want cosmetic surgery, you can do what you want on the side, is rubbish. So this is not what South Africa needs.
Dr. Letlape, in closing, is this, in your view, politicking more than it is a practical solution to the needs of South Africa?
This is politicking to the umpteenth degree. But beyond that, if you create a separate fund while they have Medical Schemes Act operational and them going to private health care, this will just be a fund for abuse. There'll be cronyism like you've never seen before. There'll be wastefulness like you've never seen before. The only thing that will work is one system for all of us. And all of us, me, the president, Kgosi Letlape, should be in that system from the first day that it is signed into law. Not anything progressive. We've got to stop being useful idiots for people that are out there.
All right, that's where we're going to have to leave it, Dr. Kgosi Letlape. Appreciate your time. Thanks so much for coming on to the show. Former president of the Health Professionals Council of South Africa.